On the occasion of World Heart Day, we have with us renowned cardiologist of India and our city Hyderabad, Dr. Mohammad Asif S, who will tell us more about heart health. So welcome Dr. Mohammad Asif S on Fit Talk Talk Show. My first question, what are common symptoms of heart attack?
The most common symptoms of heart attack are chest pain, which is Rxtor terminal, along with severe sweating. There can be a jaw pain or left arm pain. Apart from that, they can sometimes present with breathlessness or sometimes with severe, you can say, syncope, where they can have with giddiness also, or palpitations. Or apart from that, there sometimes can be atypical presentation where it can be just like a gastritis, burping symptoms and all. So these are the very common symptoms where the patient presents with a heart attack. Whenever you feel like you should not ignore these kind of symptoms, these are danger signs.
Doctor, is there any link between diabetes and heart disease?
Yes, diabetes is, we know that if the blood sugars are elevated, we call them as diabetes, where the fasting should be more than 126 and postprandial more than 140. Then they categorize as diabetes, and HbA1c more than 7 is categorized as diabetes. So whenever the sugars are elevated in the body, what happens is, again, they lead to the damage of the arteries anywhere in the body. It can be brain, it can be heart, it can be kidney. So they lead to further damage, and the chances of heart attack also increases. Overall, if you see, a diabetic patient has higher risk of heart attack compared to a non-diabetic patient. So it is very important for diabetic patients to control their sugar so that the chances of heart attack is decreased.
Doctor, does smoking increase your risk of heart disease?
Yes, the smoking is injurious to health, and we all know that the smoking, what happens is the nicotine, it gets deposited and it leads to damage of endothelial lining of heart arteries, what we call it as coronary arteries. So we have three arteries: right coronary artery, left circumflex and left antedescending arteries. So this smoking, usually what happens is it damages the endothelial lining, what we call as endothelial dysfunction, leading to thrombus formation, and the heart attack chances increases. We see many patients in our OPD and in emergency. Weekly, at least 2 young patients who come to emergency with massive MI, this main reason being the smoking.
Sir, does being overweight increases the risk of heart disease?
The answer is definitely yes, because the overweight, what happens is the chances of increase in blood pressure, increase in the load on the heart increases. And once the blood pressure, diabetes chances increases, in turn that leads to increased chances of atherosclerosis. So by increasing chance of atherosclerosis, there will be risk of blockages where the heart attack chances also increases. If you see the patient who is thin, who doesn't have diabetes, hypertension, and compared to the patient who is obese, the chances of developing a massive heart attack is higher in obese patients. So they need to be very careful, and they need to reduce their weight. That is the best mode of treatment or the best way of prevention of heart attack, where you can reduce your weight.
What's your message on World Heart Day to listeners?
There are 7 things. The first and foremost important is diabetes. If you have diabetes, you need to control the sugar. Otherwise, the chance of heart attack will increase. Number 2 is blood pressure. If the hypertension, if the BP is high, the chances of heart attack will increase. So control your BP. Number 3, if you are a smoker, stop smoking now only, immediately, so that the risk of heart attack is reduced. Number 4 is alcohol consumption. If you are taking a binge alcohol, completely stop it. And number 5 is physical inactivity. You need to move yourself, push yourself at least 30 minutes a day or weekly 3 to 4 days. Most another important thing is stress. You should distress yourself. Stress has found to increase the heart attack chances. Please take care of these things.
My first question, what are common symptoms of heart attack?
The most common symptoms of heart attack are chest pain, which is Rxtor terminal, along with severe sweating. There can be a jaw pain or left arm pain. Apart from that, they can sometimes present with breathlessness or sometimes with severe, you can say, syncope, where they can have with giddiness also, or palpitations. Or apart from that, there sometimes can be atypical presentation where it can be just like a gastritis, burping symptoms and all. So these are the very common symptoms where the patient presents with a heart attack. Whenever you feel like you should not ignore these kind of symptoms, these are danger signs.
A public awareness initiative by ipca Laboratories Limited, the makers of Rxtor and Rxtor Gold.